BBC Sounds. Music, radio, podcasts.
Hello there and welcome to the Inside Health podcast. I'm James Gallagher. For the second time in 2 years, a global emergency has been declared over Mpox. That's the disease that used to be known as monkeypox. Now, there's plenty of confusion we need to clear up here, so we're going to do that. And also on Inside Health, can you imagine living with a meat allergy? Well, we're going to chat to someone who was diagnosed after eating a plateful of haggis. And we're going to answer your questions that you've been emailing in about statins. But first, let's keep the focus on Mpox. The virus causes painful blisters and sores on the skin, as well as fever and body aches. And it can be really dangerous. There are death rates of up to 10% in some previous outbreaks. But one of the sources of confusion at the moment is that there are actually really 3 separate strains of the virus causing almost 3 simultaneous overlapping outbreaks. Each are behaving differently. So we're going to unpick all of that for you. So I'm joined by Professor Trudie from the University of Oxford, who's working with teams in Africa. Hi, Trudie.
Thank you for having me.
So I think the first thing I wanted to do was just tease out what's going on with all of these different strains or clades, because it feels like there's almost 2 or even 3, you could argue, outbreaks all happening at the same time. So can you run through them for me?
Yeah, I think it's actually quite useful to think about almost 3 different, now we can call them strains, variants or clades. So we have strain or clade 1, which was the Mpox that's been around for over a decade and we know most about. Then we have strain or clade 1b, which is the emergent new variant, which I'll come back to. And then we have strain or clade 2, that is the previous public health emergency, and that's the strain that was circulating in Europe, which began in 2022 and was associated with men who had sex with men. It was very well tackled with a vaccine programme, and we're coming to the end of that outbreak, really. So I think we can focus here on clade 1 and clade 1b, or strain 1 and strain 1b, and that I can talk about in the Africa context of how those 2 have come about together.
Okay, well, let's do that, Trudie. What's the difference between 1 and 1b?
So Mpox 1 has been around, as I say, for over a decade. And what we know about that is that it's been largely associated with the consumption of bushmeat, and somebody would bring an infected bushmeat product into the household, and that infection would be largely limited to that household, originating from the infected meat. And you could also have cases of person-to-person transmission, but it was really associated with this bushmeat and zoonotic transmission, as we often call it, animals to human. So that's clade 1, strain 1. Let's move on to 1b. So we first began to have reports in September last year of a very different presentation of Mpox, and seems to be being transmitted differently as well. And so 1b is associated with sexual transmission and person-to-person transmission from close contact. And so this is heterosexual sex, probably any form of sex, obviously, but also mother to child, child to child, child to carer, and within households.
That feels like quite a big thing.
Yeah, I think it is. And I think I've spoken to so many researchers and public health officials in Africa about this over the last few months. And so many times we've talked about the similarities to the early days of HIV.
People don't tend to use phrases, it's like the early days of HIV, very often. No, not very often, and definitely not lightly. The reason it's applicable is largely this context of where this is happening. So Kamituga, the town where this originated, is a mining town. It's linked with its neighbouring countries because it's on a trucking route, and there's a large sex trade which is common in these settings. And so that combination of young exploited sex workers who, really victims in this, the families and participants of the sex trade, the truckers, and obviously the children around all of this are the vulnerable first cases and victims, really, of this outbreak. And this was exactly the same situation for the early days of HIV, where it was really perpetuated because of the trucking routes, and it spread very easily. But let's also be crystal clear here. We've had the second public health emergency because of Mpox in 2 years, but these are incredibly different emergencies.
Yes, and I think that's why it's really important to think about this as two different situations, really. The reason that the WHO have made this a public health emergency now is because of these two variations of Mpox circulating at the same time in Africa, but presenting in different ways and being transmitted in different ways. And there's so many unknowns. Whereas we really understood what was happening in Europe with Clade 2 and were able to respond. That was quite an effective campaign. So it's a different situation, and the threats are very different with so many more unknowns in Africa right now.
And it feels to me like the previous emergency was almost easier to deal with. It was principally affecting gay and bisexual men and other men having sex with men, which meant that when you were thinking about vaccinations, you knew exactly who to target and who to get public health information across to, whereas this feels so much broader.
Well, I think the same things apply. What's needed right now in Africa is a vaccination campaign primarily, but very much a public health campaign, understanding risk behaviours and explaining to people what the risks are so they can change their choices and hopefully stay safer. Really working on the vulnerable members of community that this has affected, these exploited young sex workers, mothers, children. So it's the same principles apply. We just need to put them into place in Africa.
How would you assess the risk in places like the UK or the rest of Europe, where there are obviously very big societal difference between the UK and, a war-torn part of the Democratic Republic of Congo?
Yeah, I think the risk is still very low in Europe. And I think if cases do come back in, hopefully cases will be detected very quickly. And of course, we've got vaccines in stock. And I hope there will be a very rapid vaccination campaign if it was needed. So I think the risk to Europe still remains the risk in Africa, and the need to mobilise vaccinations and response in Africa is the best thing that could be done to protect the risk in Europe.
Trudie, thank you so much for coming on.
No problem, no problem.
Well, Mpox is something we'll keep a close eye on Inside Health. And thank you for listening to the Inside Health podcast with me, James Gallagher. The producers were Tom Bonnet and Hannah Robbins, and the assistant producer was Katie Tomsett. Technical production by Nava Masirian. The show was made by BBC Wales and West in collaboration with the Open University.
BBC Sounds. Music, radio, podcasts.